If you've been doing some research during your health journey, you may have come across the term adrenal fatigue and said, a lot of these symptoms really sound like me. But upon further digging, you'll find that there is some controversy associated with the term. So what's really going on here, and how does this relate to your thyroid gland? All that and more will be covered in today's video. And as always, if you're enjoying this kind of information, I appreciate it if you can give the video a like and subscribe to the channel. My name is Dr. Bodle, and I specialize in helping women improve their energy and lose weight by naturally supporting their Hashimoto's and low thyroid conditions. But what is really important for us to all understand is our thyroid doesn't work alone. It does not exist in isolation. And it's heavily involved with many other systems in our body, one of those being our adrenal system. So to be able to improve both thyroid and adrenal function, we have to understand how they work together. So let's start off by first defining our adrenal function and why saying adrenal fatigue has a little bit of a problem in terms of the definition. So why is there so much controversy over the term adrenal fatigue? And there's actually a couple problems here, but the main one is that medical practitioners and alternative healthcare practitioners don't agree on the definition, and when they say adrenal fatigue, they're actually talking about two very different things. So if you go to a natural or holistic doctor and you have symptoms like fatigue, especially in the afternoon, low blood pressure, salt cravings and increased urination, poor muscle endurance and strength, and also you're having a tough time staying asleep at night, they may do some blood tests or some salivary tests, and if there's changes in cortisol levels in addition to those symptoms, you're likely going to be diagnosed with adrenal fatigue. But if you take those exact same findings to your medical doctor, they're probably not going to think too much of the results. And the reason for that is because it doesn't meet the diagnostic criteria to justify what they call adrenal insufficiency. Now, adrenal insufficiency is a chronic and severe condition where the main key is that your adrenal glands can no longer produce hormone like they're supposed to. So you can have all the symptoms that I just mentioned, plus typically there's discoloration in the skin, and if someone were to do an adrenocorticotropic hormone stimulation test, it's a lot to say, it would not show any changes or any elevations in cortisol levels. So let me explain that. In your medical doctor's mind, if you come in saying, I have adrenal fatigue, they're then thinking, okay, does this person have adrenal insufficiency, and how can we rule that out? And if they think that the symptoms are severe enough, they will do, as I said, an adrenocorticotropic hormone stimulation test. Now, adrenocorticotropic hormone, or ACTH, you can kind of think of that like TSH. It's the hormone that's released from your brain, from your pituitary gland, to stimulate and activate adrenal function, or release the hormones that our adrenal system makes. The thought process behind this kind of test is, if our adrenal gland really isn't functioning, really isn't producing hormone like it should, then putting that hormone in an exogenous and synthetic form into the body will tell us whether our adrenal system can respond or not. So if we put that medication into the body and there's no response, then that would be diagnostic of adrenal insufficiency. But if we put that medication in and we see an elevation in adrenal hormones, then that would suggest that the adrenal glands are still functioning and we don't have insufficiency or fatigue. Since most instances of adrenal insufficiency are caused by diseases like Addison's disease, a lot of patients don't have that total destruction. So when they take the medication, the adrenocorticotropic replacement, there will be an increase in cortisol. And so the disconnect happens because they go to their natural healthcare provider, they say you have adrenal fatigue, you then go into your medical doctor, they do this sort of advanced testing, and they say, nope, that's hogwash, you are fine. But as with a lot of chronic health conditions, you're still suffering with the symptoms. So if one doctor says you're not fine and the other one says you are fine, what do you do about the symptoms that you're experiencing? Because at the end of the day, that's what's most important. Are you feeling healthier, right? And is your function improving? It doesn't really matter what the testing says if you don't feel the way that you want to feel. So with so much disagreement and confusion over your diagnosis, what's really going on here? And that brings us to our second problem when it comes to using the term adrenal fatigue, which is that whether you're in the medical system or you're a natural healthcare practitioner, both of them are looking at this through the lens of it being a primary gland problem. So what I mean by this is both natural and medical practitioners are looking at this and trying to determine, are your symptoms coming from low adrenal gland output? Is there a problem with the actual gland? Natural practitioners would say, yes, there is a problem with the gland, but it isn't severe or chronic enough to get to the point where we can say it's adrenal insufficiency. We're in that gray area where we're progressing towards that endpoint. On the other hand, medical practitioners would say, no, we did the testing, we stimulated the gland, and it responded normally. Therefore, there isn't a problem with that hormone production. However, for the vast majority of these patients, both approaches are wrong, because whether we do replacement hormone in the medical world or we're giving someone a bunch of adrenal adaptogens and adrenal support, neither is addressing the root cause of the problem, which is this is not a gland problem, it is a brain-based problem. So instead of saying that you or someone else has low adrenal function, it's actually more accurate to say that we have low HPA axis function or a decreased HPA axis response. If you're not familiar, HPA axis stands for hypothalamic pituitary adrenal axis. So just like with our thyroid and just like we talked about before with TSH and adrenocorticotropic hormone, this whole process starts in the brain, and it starts in our hypothalamus. Our hypothalamus communicates with our pituitary, which releases ACTH, and that then stimulates the hormone release from our adrenal system. But if we have chronic stressors and we're chronically activating that HPA response, the sensitivity of the brain for those types of changes will go down, and therefore it will require higher amounts of stimulation or higher amounts of stress to get the same sort of hormonal response from our adrenal glands. The best way to think about this is if you have a temperature control system in your home or at your workplace. So if the temperature outside gets too low, your heat should kick on, and if the temperature outside gets too high, then the AC should kick on. But to know when it's appropriate to have either AC or heat, we have to have a sensor that's working to be able to determine what the outside and then the internal temperature of the building looks like. If that sensor is broken, then it doesn't matter if our heater and our air conditioning is in good working order, because they're not there to be able to determine when they should turn on. They're just waiting for the message from the main console to be able to know when to do that. So in cases where you're having adrenal symptoms, and as we said, this is a decrease in HPA response, what's going on here is that sensor isn't working. The brain isn't interpreting the changes in its environment and the changes in the blood hormones to be able to accurately communicate that to our adrenal glands or any other glands in the system. So if our brain's working correctly and monitoring the situation well, it should keep our hormones within a relatively tight window of space. That way it can respond to any stressors on the system. But if it isn't working well, then that sensitivity is lost and it allows for greater variability in where our hormones will trend, either high or low. So instead of your temperature sensor keeping your home or office space within 67 to 69 degrees, now that window becomes much wider. So we're going from 60 degrees to 75 degrees. And obviously that can make things a little bit uncomfortable for you, and you're going to keep checking the sensor, looking and waiting for it to say, hey, we're getting a little cold here, we need that heat to turn on for us. But because it isn't working, again, it's not the heater's fault, it's the sensor's fault. And while this might sound like a nice theory, the question is it actually true? And the answer is yes. Research has shown that although in those situations where we do an ACTH stimulation test, we can see increases in cortisol, which would suggest that things are normal. However, if we instead use insulin to drop our blood sugar, which cortisol is heavily involved in managing, the brain does not assess this drop as readily as it should, and therefore there's a delay in the response for that brain to communicate with our adrenal, and therefore the consequential release of cortisol to manage our symptoms and blood sugar levels. So to tie it all together, can our adrenal glands respond and produce hormone when they need to? And the answer is yes. But the gland is just a worker. It's going to only do its work when its boss tells it to. Therefore, if the sensor in the brain isn't working like it should, then there isn't going to be that good communication, and therefore we get symptoms of low adrenals because they're not being told to produce hormones when there are these dramatic changes in our physiology. So hopefully that all makes sense, but if you have any confusion, feel free to just drop those questions in the comments box below. And also let me know if adrenal fatigue or adrenal symptoms is something that you deal with, and what sort of things have been really supportive and really helpful in terms of turning those things around. I always love your guys' feedback, and it's helpful to learn about different strategies that have been working for you. So finally, our last topic to discuss today is how does our thyroid play a role in all of this? And there's actually a couple of key areas that it's heavily involved. The first part is going back to some of our thyroid basics and asking ourselves, what does thyroid hormone do? So, as a reminder, thyroid hormone is the gas pedal for every single cell in the body. It's what makes things go, and it's what sets our metabolism. And different cells that have a higher metabolic rate are more susceptible to changes in thyroid hormone. One of the most metabolically active parts of our body is our brain. And so if we have changes in thyroid hormone, especially low thyroid hormone in our circulation, our brain isn't going to function like it should, and this can lead to a whole host of symptoms, whether it's depression, anxiety, brain fog, or changes in memory. In addition to that, since one of the main jobs of the brain is to monitor our hormone levels, if it doesn't have enough get up and go, it doesn't have enough thyroid hormone, then our ability to do just that is going to become diminished. So if the focus of good adrenal function is maintaining a healthy HPA axis and we have decreased brain function, then we're going to have a decrease in the responsiveness of that communication between the brain and our adrenal system. And while this is a huge piece, it's not the most important part. Remember when I said that chronic activation of the HPA axis diminishes the brain's responsiveness? Well, we always have to work our way back and say, what is the root cause here? What is that trigger that is causing the dysfunction in this part of our body in the first place? Well, we know if we're having low thyroid symptoms that the most common cause of hypothyroidism is an autoimmune condition called Hashimoto's. And if there is anything that will flare up our immune system, that will be enough to cause both thyroid dysfunction and also activate the stress response from our HPA axis. So if your immune system isn't being properly managed and it's consistently being triggered, then that's not only going to lead to thyroid dysfunction and symptoms, but it will also lead to these low adrenal symptoms that we've been talking about today. So whether it's blood sugar crashes, fatigue, and difficulties with sleep because our cortisol isn't well regulated, or we're having low blood pressure, dizziness with standing, and cravings for salt because aldosterone has changed, or even we're having hormonal issues with sex hormones like testosterone and estrogen leading to menstrual symptoms or changes in brain function, all of these hormones are produced by our adrenal gland, and we can have symptoms in all of these areas if our Hashimoto's is not regulated, is flaring up the immune system, and therefore there's downregulation in the HPA axis, and none of these hormones are being secreted like they should be. So that's a lot, but let's review. Adrenal fatigue is a little bit of a misnomer because it really doesn't have a lot to do with our gland. Instead, it has more to do with our brain because of chronic stressors in our system. So it's more appropriate to say we have a decrease in HPA responsiveness. Next, if we don't manage and reduce the triggers that are causing the HPA axis dysfunction in the first place, we're not going to see improvements in our adrenal symptoms. So for people with low thyroid issues, the most common problem is Hashimoto's, which is an autoimmune disease that can trigger that adrenal response. So if we don't work on and support our immune system, we're not going to see the changes with our adrenal function. Lastly, when our thyroid symptoms are contributing to our adrenal symptoms, it's not just one thing. All the hormones that our adrenal gland release can be affected, including cortisol, aldosterone, and sex hormones. And therefore, you can get symptoms related to any one of those. Hopefully the information in this video is helpful to you today. But if you're continuing to struggle with thyroid and adrenal related symptoms, then I encourage you to take the next step. Send us an email at contact@seattlethyroidhelp.com and we'll get you all the information you need to be able to hop on the phone with me, discuss what's going on with your health, and determine if we're a good fit to work together one-on-one. We specialize in chronic conditions where people have been to 10 plus doctors and have little hope for seeing improvement. I know that if we do a good job of listening to you, understanding what's really going on with your health, then we can do some things differently to help you get back on track. If you're not yet ready to work with me one-on-one, that's totally okay. But make sure to grab my free download in the description box below, which is 109 foods to boost your thyroid and improve your energy. And it's a list of do's and don'ts for food choices that we use with my patients every single day. Besides that, thank you so much for watching, you guys. Hit the like button, subscribe to the channel, make sure you check out some of my other videos, and say hi on social media. My name is Dr. Bodle, and I will see you guys in the next video.